Dehydration causes or is linked to the deterioration of a vast array of conditions. This includes the more minor problems of tiredness, headache, dizziness, overeating and constipation. These themselves can become more serious if not addressed, and can be the cause of human error for us and for falls for the frail. More serious consequences, as well as falls, include pressure ulcers and infections such as urinary tract and gram-negative bloodstream infections, which in turn can cause confusion and, in turn, falls. Ultimately, reducing dehydration can prevent hospital admissions, reduce the length of stay for those who are admitted, and reduce other complications such as acute kidney injury and ultimately death. Dehydration also affects concentration and accuracy. So that we can give the best care, we must also self-care. Most of us know that adequate hydration is an important part of wellness. So why is dehydration a problem? Knowledge itself isn't always enough for action, so is it time for a different approach? Let's try the but first to drink approach. The but first to drink approach is simple. Offer a drink at the start of your contact with the person. An important principle of but first to drink is that the ability to improve hydration is shared by everyone who comes into contact with the person. That might be as a health or social care worker, no matter what your role, or as a volunteer, neighbour or family member. By offering it at the start, it means you don't forget. You can encourage, remind and assist the person if necessary, and it can also be a useful insight into how the most vulnerable are coping. If everyone takes on the principle of offering a drink at the start of their contact, together we can significantly reduce dehydration and its complications. Without meaning to state the obvious, if somebody is nil by mouth or on a fluid restriction or needs thickened fluids, it's important to follow medical and professional advice. If the person's awaiting a procedure, please make sure that they're kept nil by mouth for fluids for the minimum amount of time, which is usually only 2 hours in adults. It is useful to know that a nourishing drink such as milky coffee, a glass of milk or a milkshake can also provide a useful source of energy for people at risk of malnutrition. A person's cup of tea or glass of water is usually on their bedside table, but how often do you see tables moved out of reach? Obviously, there is often a very good reason for needing to move a table, but let's think differently. Could the person actually have a drink whilst they are having their dressing changed, or talking to you about their treatment plan? And please remember to put the drink back in reach as you leave. But first a drink is easy to implement, and it costs nothing but thoughtfulness. Get involved to keep your patients and yourselves well.